Hi, this is Dr. Amir. Today we will discuss disease called Naegleria. Naegleria is a dangerous amoeba found in freshwater that can cause a rare and deadly brain infection. Signs and symptoms of Naegleria infection include severe headache, fever, nausea, vomiting, stiff neck, confusion, seizures, and coma. Precautions against Naegleria include avoiding warm freshwater, using nose clips while swimming, and ensuring proper water hygiene and sanitation. To prevent Naegleria infection, it is important to avoid swimming in warm freshwater bodies such as lakes, hot springs, and poorly maintained swimming pools. Use nose clips or hold your nose shut when participating in water activities in freshwater. Keep your head above water while swimming in warm freshwater. Avoid stirring up sediment in freshwater bodies, as Naegleria can be present in the sediment. Ensure proper maintenance and chlorination of swimming pools and hot tubs. Use distilled or sterile water for nasal irrigation or when using a neti pot. Avoid activities that involve water entering the nose forcefully, such as diving or jumping into bodies of warm freshwater. Teach children about the risks and precautions associated with Naegleria infection. Regularly clean and disinfect water-related equipment, such as diving masks and nose clips. The diagnosis of Naegleria infection involves the following tests. Lumbar puncture, a sample of cerebrospinal fluid, CSF, is obtained through a lumbar puncture, also known as a spinal tap. The CSF is examined for the presence of Naegleria amoebae or any abnormalities indicating infection. Microscopic examination. The collected CSF sample is examined under a microscope to identify the Naegleria amoebae. The amoebae can be observed using staining techniques. Polymerase chain reaction, PCR. PCR testing can be used to detect the presence of Naegleria DNA, and the collected molecular CSF technique amplifies the genetic material of the amoeba for identification. It's important to note that the diagnosis of Naegleria infection requires specialized laboratory facilities and expertise, as if there is a suspected case, it is crucial to consult with a healthcare professional or an infectious disease specialist for appropriate testing and diagnosis. The treatment of Naegleria infection, also known as primary amebic meningoencephalitis, PAM, is challenging and requires prompt medical intervention. The following measures are typically employed. Antimicrobial medications such as amphotericin B, a potent antifungal agent, are administered. These medications aim to target the Naegleria and control the infection. Supportive care. Treatment also involves supportive measures to manage symptoms and provide relief. This may include medications to reduce inflammation, control seizures, alleviate pain, and manage complications such as increased intracranial pressure. Intensive care. Due to the severity of the infection, individuals with Naegleria infection often require intensive care monitoring. This may involve close monitoring of vital signs, respiratory support, and other measures to stabilize the patient. Hypothermia treatment. In some cases, induced hypothermia, lowering body temperature, has been used as an experimental treatment to improve outcomes. This treatment aims to minimize brain damage caused by the infection. It is important to note that despite treatment, Naegleria infection has a high fatality rate. Early diagnosis and immediate initiation of treatment offer the best chance of a favorable outcome. However, due to the rarity and rapid progression of the infection, prevention through avoiding exposure to contaminated water sources remains the most crucial approach. Health tip of the day. Stay hydrated by drinking an adequate amount of water throughout the day. Proper hydration supports overall health, digestion, and cognitive function, and helps maintain a healthy weight. Remember to drink water regularly and listen to your body's thirst signals. Please share your comment on today's session. Goodbye. But before that, health tip for you. Stay hydrated by drinking an adequate amount of water throughout the day. Remember to drink water regularly and listen to your body's thirst signal.